The Indiana Courier sat down with doctors in Mississippi County to reiterate the importance of social distancing, provide information about testing, and to address some of the myths about COVID 19.
I think the most important thing is that we continue to take this virus seriously. I know with the country opening up, people have a tendency to forget the need for social distancing. And I think it's very important that we keep up the social distancing, trying to stay at least 6 feet apart from one another, wearing masks, and making sure that we're washing our hands daily, frequently, to try to prevent the spread of the virus.
People need to wear masks all the time in the stores because you're touching different things and everyone else is touching different things.
I've had people who want not to get medical tests and procedures done because they were afraid to go into the hospital. And I want to let you know that we've worked really hard to make sure that the hospital is very safe to come to. Everyone's screened that comes into the hospital. We're checking temperatures at the door, we're asking questions, and we're sanitizing a lot. Get the medical attention that you need. I mean, because the COVID is affecting the African American community primarily because a lot of us don't address our medical needs. So with us not being as busy because of this virus, please come on out and see us.
A couple of myths that I've heard over and over again that I wanted to address were, one of them is that you're way less likely to get this than the flu, and that is a myth. The flu is virulent, meaning it is transmitted through cough, sneeze, droplet, spray, aerosol. However, when we look at the actual numbers of how many people actually contract the flu from one person, we call that number R naught. The flu has a R naught number of 1.3, and that's almost one person less than the COVID-19 virus, which has an R naught number of 2.2. So for every one person that has COVID-19 that's out in the public, we expect 2.2 people to contract it. For every one person that has the influenza virus, we expect 1.3 people to contract it. So this virus is much more virulent than the regular influenza virus. Another myth that I wanted to address was that the COVID-19 virus is just a mutated version of the common cold. And that one is also not true. The coronavirus is a family of viruses. There are 4 that do cause the common cold, but there are dozens of others that cause other diseases. And so of the 4, the COVID-19 virus is not one of those 4 that causes the common cold.
One of them is that the testing for the coronavirus actually gives you the virus. That is a myth, along with the fact that a microchip is being placed when we give you the test. That is also a myth. Also, a myth that we wanted to address was that taking NSAIDs such as ibuprofen or Motrin could actually cause you to spread the COVID-19 or make the condition worse. That is also a myth. You can take ibuprofen, especially the older patients that has osteoarthritis or any joint aches and pains, fevers for other reasons. They can take ibuprofen, and that's perfectly safe. Another myth to address was that rinsing with a saline rinse will decrease their chances of contracting the virus. This again is a myth. True, rinsing can help with allergy symptoms, but it will not decrease your chances of contracting the virus. The only thing that will decrease your chances is hand washing and physical distancing yourself from others. Additional myths that some of the younger people are considering is such as drinking alcohol. That is also a myth. That will not prevent you from contracting the virus.
Health department can do your test for COVID every day at 8:30 to 3 o'clock. Now that is a self-test where they give you the swab, you put it in your own nose, and you leave it there for 20 seconds. You must call first to the health department here for that test.
So Mississippi County Hospital Systems, Gray River Medical Center is also performing testing. They are Monday through Thursday from 8:30 a.m. to 4:30 p.m. They are doing the nasopharyngeal swabs as well as the serology testing.
We are testing in Osceola, Arkansas, at the Willis Clinic. We will do the nasopharyngeal test, and we're also doing the serology test for the antibodies. We test Monday through Thursday. Please call, and we'll set you up with an appointment. You'll pull to the back, and we will test you while you're still in your car, and then we get the test results back in about 24 to 48 hours. Dr. Thakur's office is also doing testing, as is the hospital.
This is John A. Washington, NEA Town Courier.